The one thing that all women have in common with PCOS is the elevated androstenedione. So I like to start there first to just get a yes or no, do we have PCOS or not, right? Because not everybody has these cysts. So I also have women come to me that say, oh, I took the pelvic ultrasound, I don't have the cysts. But then when I find the elevated androstenedione, I say, yes, you do, because you have all the symptoms just because you don't have the cysts.
Welcome back to the PCOS Holistic Coach podcast with me, Dr. Ami Patel, pharmacist, fellow sister, and coach. This podcast is an easy to listen to resource for your busy on-the-go life. You will learn how you can live a healthier and happier life with PCOS from real conversations about managing PCOS and the symptoms with amazing guest speakers. I'm excited to be here today and have a live conversation with Dr. Diana Drake. Dr. Drake, thank you so much for being here today.
Yes, thank you for having me. So excited to get some info out to the community as a fellow sister myself.
Yes. I know it's great that we're able to connect. Just a little bit of introduction about Dr. Diana Drake. She is a board certified traditional naturopath, licensed esthetician, creator of skin, naturopathic skin wellness supplements, and owner of DMD Natural Medicine Clinic. She's passionate about healing the skin, thyroid, and hormone issues using naturopathic medicine. And I'm so excited to get your perspective on insulin resistance with PCOS.
Yeah.
So thank you again for being here.
Oh, of course.
So from your experience as a naturopath, how do you test for PCOS compared to how Western medicine primarily focuses on testing?
Okay, I love this question because 99 out of 100 times, actually, no, I will say 100% of the times when a client comes to me and says, oh, I've already had a hormone test, the doctor only will test for free testosterone, estrogen, progesterone, and maybe they'll get one cortisol time. This does not help us whatsoever. The one thing that all women have in common with PCOS is the elevated androstenedione. So I like to start there first to just get a yes or no, do we have PCOS or not, right? Because not everybody has these cysts. So I also have women come to me that say, oh, I took the pelvic ultrasound, I don't have the cysts. But then when I find the elevated androstenedione, I say, yes, you do, because you have all the symptoms just because you don't have the cysts. So we do know that elevated androstenedione is across the board. We have it, right? So I always like to start with saliva androstenedione tests. And I'll also just, while I'm having them, because they use the same tube, I'll get the progesterone, because typically we'll have the elevated androstenedione and the low progesterone. So I'll grab the androstenedione, then I know, okay, do I have a yes or a no? Then I'll start looking at other factors, testing the insulin, testing the A1C and the blood sugars, looking at the cortisol, all those other kind of things. But I really, really like to start, because otherwise we're sending our clients off getting all this lab work, right? When we just need to know the one kind of yes or no question first. Then from there we can go on. And I do still, if they have it, I like to see, okay, do we have cysts? Where are they? Are they big? So then we can go do more discovery from there. But yeah, initially I just like to grab that androstenedione. I personally like saliva. When our blood carries hormones, they're connected to little things called carrier proteins. So I like to test saliva because we get more bioavailability, because it's actually coming from a saliva gland. So it's in the glandular system. So it's a little more sensitive for excess and deficiency. So that's why I like to grab saliva, which people always say, okay, is that a test covered by insurance? It's not, because it's not something that Quest or LabCorp does. So I just have it on my site. It's a $200 test. We send you a little 2-tube kit to spit in. Right. And then it comes with me consulting with you virtually saying yes or no, you don't have it.
Okay. That's good to know. Yeah. I was actually surprised you even said that they even test like cortisol and like free testosterone, because I feel like
they don't.
Yeah, usually they don't even do that much. Like
lazy.
Yeah, that I see. Sometimes they're like, oh, like they just have a hemoglobin A1C, which like that doesn't even tell you anything about PCOS.
Yeah. And it's, a lot of people get so mad. They're like, oh the doctors are stupid, blah, blah, blah. That's not what's going on. Yeah. They just don't have training in this space. I don't think that they're purposely trying to, hurt us or not do what they really don't know. And there's no drug for it. And a doctor's job is to diagnose you and give you a drug. So if they don't have a drug for PCOS, they're not being trained about how to properly diagnose it.
Exactly. And that's like a whole different conversation about the lack of like research and funding behind it. Without that, right, there's no like evidence-based clinical trials, and therefore like providers aren't getting taught this in school. And so then when a patient goes to see the doctor, this is why they don't have all the information. So it's not to say that they're purposely doing this or they don't know, like you said,
Right.
but it's just, yeah, there's just not the research behind it yet.
Exactly. Yes. Well put.
Well, what exactly is insulin resistance and how does it lead to PCOS?
Sure. So I kind of like to describe it as, insulin, first of all, is a hormone, and it's what allows our blood sugar to actually move from our blood into our cells to be absorbed for energy. And it literally, when you don't absorb the insulin, I kind of say it's like our cells can't see it. So it's not going in or out when doing its job. And this, I think it has a lot to do with the exterior of the cell kind of hardening a little bit, so it's not as permeable, which I think has a lot to do with not having the proper amount of omega fatty acids in the diet. So I think it's very important to have a high dose of omegas. Obviously, we're not going to eat fish 3 times a day and it has heavy metals, but take a good omega supplement, and I like to triple it. So if an omega supplement says take 1, I take 3. So whatever is on the bottle, I'll triple it. You can also do like coconut oil, lots of olive oil, just lots of omegas. And that really helps with the cell's permeability, because every single cell in our body has a lipid barrier that needs to allow things in and out. But basically, yeah, insulin resistance is just your cells can't see the insulin. So now we have blood sugars just building up in the blood instead of getting utilized like they're supposed to. And they're not supposed to be hanging out in our blood. Yeah. So that causes a lot of issues for sure. Definitely leads to the stubborn belly fat. And then, I don't, every case is different with PCOS. I definitely, I feel a little sick when I get too much sugar. So I don't know. I don't, some people, if they don't eat, they feel sick. So it's just when it's working properly, you don't have those fluctuations, I think, going on. But as far as like why exactly this is linked to PCOS, we don't have that data set. We don't know. It's one of those frustrating things. We just know it's a thing that we need to watch out for. Also carbs, ladies, carbs are also a form of sugar. So to really control that high blood sugar, yes, we want to stay away from processed sugar, but also watch out for starchy carbs, breads, pastas, even
simple ones. Complex are okay, right?
Correct. Okay. Yes. So I like to say starchy things or processed grains, but yes. So simple would be what I just said. The complex things we want, that's like broccoli and all of our veggies. And I know it's kind of a argument about fruit. I think fruit is still good for us.
I'm with you on that. Yes.
Yeah. So, but if you are super sensitive, if you just want to stay like around more of the berries and the citrus fruits and less of the tropical, the banana, the really sweet stuff, that might help as well. It's just, everybody is different.
Yeah, exactly. And I was laughing earlier because like I had, I'm visiting my friend and like she got this, she knows I love Oreo, anything. So she got Oreo ice cream for me, which I don't usually eat and I haven't in like such a long time. And I'm like, okay, so I had it. And then I was like, yeah, this is like why I don't eat like this much ice cream in one sitting.
Yeah.
So, yeah, I was laughing earlier because of that. And then I know you started to touch on this. So what are some natural ways to address like the insulin resistance? I know we talked about, fruits, complex carbs.
So, you can do a lot with diet, but I still think we need a lot of supplementation. Omega is very important. You guys, your community is probably very familiar with my own isotal. That's kind of that's the number one supplement really for the blood sugar resistance. So I think that and the omegas are a slam dunk from a supplement perspective for the insulin resistance. And then just watching the carbohydrate intake and sugar.
Yeah, so I'm curious, like about the omegas, like that's actually something new for me. So you were explaining, like basically it increases the permeability of the cell, so the insulin. So it's like So insulin resistance is basically like saying that your cells can't process the insulin, right?
Yes, like it literally, it's like, hello, and it can't come.
Yeah.
And think about how many times, like just the foods we eat on such a regular basis, French fries,
Yeah.
fried chicken, every salad dressing that you order at a restaurant, that's got canola oil in it, not olive oil. All of those oils are inflammatory, and it's like putting the wrong oil in our engine. Those all lead to the hardening of the cell because it's not the right oil. So we really have to replace it and make sure we get those good oils in there. I think that really helps significantly.
Yeah, that's actually interesting. So I know it's like, I mean, it's always multifactorial. It's not like that's the one
100%. Yes. Yes.
done as well. So yeah, that's really good to
Mhm.
mention. And going along with that, so why do certain like supplements work for PCOS and some don't? Are there like specific ones? I know we talked about like myo and acetals and omega. Anything else?
Mhm. I would say if you don't respond well to myo-inositol, you could do kind of like a cinnamon blend is really good for blood sugars.
Mhm.
You can even walk into a Whole Foods and say, hey, do you have a good blood sugar blend? And they'll have something that's more herbal based. Myo-inositol is actually a sugar alcohol. So some people might not respond well to that. Others do, but we're all bio individuals. What I really want to encourage people is kind of just like what you said earlier. There's not just one thing. Like you're not going to go to the store and just buy myo-inositol and magically cure your PCOS. It's just not going to happen. And there's no cure, right? We have to manage these things forever. It's always going to be a protocol. Protocols are dealing with multiple root causes, and there's probably going to be a couple things for each root cause, and that's a normal thing. So we want to seek full protocols, not individual products, if we really want to get all the things going on.
Yeah, and so that means not just supplements, but also combination of lifestyle, right? So like we mentioned, inflammation, insulin resistance. I mean, there's a little bit of a genetic component if like your family has a history of diabetes, and then stress is a factor, environmental factors, all of those contribute to symptoms of PCOS. So they all have to be addressed.
Yeah, and also some women will respond to, like I make a whole PCO assist kit with my supplement line, and some women respond very well to the base dose. Some women I have to do 2 times, 3 times the dose. I call that dose response. So sometimes maybe you are on the right supplement, you're just not getting enough of it. So there's all kinds of things. I think it is good to work with a practitioner in some regard, especially at the beginning, just to set you up to know, like, what am I supposed to be doing? Another thing that a lot of people miss with PCOS is we really, really need to detox, especially with, having either too heavy of periods or not enough periods. It's really, really important to detox. So if you're having the really heavy periods, the detoxing is actually going to help lighten them. And if you're not having enough periods, it's going to help get all the junk out of your endocrine receptors, get all the disruptors out of the receptor sites so that we can get more hormone activity so that we can bring in the periods and they're not so out of balance.
Yeah. What do you mean by detox? Like diet detox?
Great question. I mean a dedicated set of products that you're taking that are going to bind to and flush toxins. So I make a set, it's called a step 1 cleanse kit. I call it step 1 because I think everybody needs to do that at the beginning of any protocol. So my brand, Skin Naturopathics, we focus on skin conditions. And because PCOS acne is probably 50% of what I do, like of my customers with that brand, we really need to cleanse everybody. So first, it's a colon cleanse, a kidney and liver detox, and then a skin detox. And this is all just, there's like herbs, charcoal, blood purifiers, some things that are antimicrobial. So you're just going to take a set of these 3 herbs, and some people just do one detox and their skin's cleared 50%. People that are going slower, they have to cleanse for longer. I think initially I did 6 full months of cleansing until my periods, like I don't even feel it literally came the other day and I had it was coming. But it used to be like a terrible, like my boot, but I didn't even know. I was like, oh my gosh, my period came. So I pretty much detoxed myself until that happened. And then I continue to do it every quarter. And that really has set apart. I mean, that's like the most important thing my personal body has responded to.
Yeah, that's good to mention because I think there's like, that common misconception that periods are supposed to be like annoying or heavy or frustrating. But really, they're supposed to be, like you said, like,
Ah,
it's not supposed to impact your daily life like people think it should, and it shouldn't be annoying. They should be, like, pain-free. They should be
mhm,
like it just comes and goes.
mhm.
So, yeah, it should definitely just clearing that up for anybody that's
I
like,
know, and it's sad
it's
because
supposed
when
to
we're
be.
young, we just have our horrible period, and then our acne is bad, and you're like, "Mom," and then they take you to the doctor, and they just put you on
Yep.
birth control.
Yep, yep, that's
And
what I get to.
what I really like to tell women is that the only first of all, it's terrible for you putting yourself on hormone therapy. The only reason you should be on birth control is to control getting pregnant. If you're doing it for skin or periods, there is another way.
Yes.
We can do it with supplements and diet and other things. It's just people just don't understand that they have PCOS. That's the problem. The doctor never says, "Oh, let's check her for PCOS." They just give out the birth control.
I know, and like you were mentioning before, like it's complex. It's not like PCOS is not just like you don't get your period, so let's give you birth control to give you a
Mhm.
withdrawal bleed, like you said, right? Like there's a factor of your gut in there, your liver metabolism, all of that contributes to whether you're getting regular cycles and how your skin is. Like everything is interconnected, whether people realize it or not. So you can't just take
Yeah.
a pill and shut off your
Yeah.
whole, like, reproductive system and all your
Mhm.
hormones and then just get
Yeah.
the ones, like, from the, medication. So I know, like, you did mention there are, alternatives. Is there any other treatments, like, maybe in your protocols that you have that are alternative
Yes.
to birth control and or
Yeah.
Western medicine, like metformin? That's the other one that's, like, commonly prescribed, those 2.
Yeah. So metformin, so the myoinositol and the omegas will give you pretty much the same result as the metformin without the
Mm,
side effects.
yeah.
I've seen it bring blood sugar and A1C into range in very similar fashion. Then you want to cleanse, you want to detox. So I like to teach everyone to always cleanse the whole body at once, right? People will say, "Oh, I just did a liver detox last month." And I'm like, "Oh, that's nice. So you dumped a dirty liver into a dirty colon and you didn't cleanse your colon." People don't realize when
I
you're cleaning
know.
your body, you want to clean the whole thing out. So that's why I do the colon cleanse, kidney and liver, and skin detox. Okay. So then I have a product, doesn't have to be my product. There are others out there. I call mine Andro Assist, and it's probably like 6 or 7 herbs that just push down the androgen levels. So they are just herbs that are known to lower androgens. It's like white peony is in there. There's some licorice. There's some reishi mushroom. I also have, if you are skewing towards the heavy periods, I have a product called Lighter Cycles. Significantly will impact your heavy periods. Like they will be so much better, even if you don't have PCOS, if you just have heavy periods. So it kind of stops the hemorrhaging, right?
Mhm,
So it's just a
mhm,
little bit more comfortable. What else would I do in there? I'm trying to think of all the things and then Inflammasist is another one. So
mhm.
that's just a quercetin, curcumin, and then I'm bringing in a patented ingredient called polynol, which is known for reducing like 5 specific inflammation pathways, which is cool. I'm trying to think my other things. And then I have one called Metabolic Assist, which is a berberine formula that helps with both the insulin resistance and metabolism. And it's also just great for kind of cleaning out the junk in microorganisms in your body. So we're dealing with detoxing,
Mhm.
blood sugars, lowering androgens, and inflammation.
Yeah, I love
You
it.
kind of hit those 4 things.
Yeah, multifactorial approach, and I think
Mhm.
you were mentioning, like, skin. I know like, skin is technically like an organ that we don't
Yeah, it
realize,
is an organ. Absolutely. The
and, like
biggest organ.
yeah, exactly, and so, like, getting the things like rashes or, like, pimples and acne, that is a way your body is trying to release toxins, right?
Yes.
If I'm understanding correctly, I
Yeah.
think, in
So
addition to the inflammation that
yeah.
can cause acne too.
Yes. So what is happening is because we have a higher, an androgen is a testosterone,
Yeah.
and we're not supposed to have that. That's for boys. Well, we're supposed to have some, but not so much. And what happens is it actually increases sebum production. So PCOS acne is usually here. It's really deep, cystic, dark. And it's just that elevated testosterone gives us more sebum production. So it just causes more blemishes on our face. It's very frustrating.
Yeah, and you know what I noticed, and I don't know if it's because I have darker skin, but I feel like when I have like higher levels of insulin in my body, I
Mhm.
felt like the scars that I was getting from acne were also darker and they lasted longer.
Interesting. Yeah.
Like over time now that it has improved significantly, like
Yeah.
I only get maybe 1 or 2 pimples before my period, and even
Mhm.
that, like, I don't get the scars that used to stick around, which I'm, like, so glad
Right.
about. But
That's
I
really interesting. Yeah.
yeah, I
Yeah. And
need to see if there's any, like, direct correlation or research, but personally, that's what I've noticed with
I
me.
feel like I also will break out when I have more sugar, so it has to be something to do with the insulin resistance. Um, it would be a matter of like, can we actually find that data where we can claim like
Exactly.
found it?
Yeah, but anecdotically, or well, from my experience, at least with
Yeah.
darker skin and, like, noticing the insulin resistance improving over time. Because
Yeah.
I know, like, even with the insulin resistance, right, like, you can get the darkening behind the neck and things like that, so I think that
I think I've only seen that when people go on medication. Did you see it before?
yeah, before it's like a sign of insulin resistance, getting the
Got it.
darkening, like, behind the neck and the
Yeah.
arms and things like that.
Okay, interesting. I always thought it was a side effect of the drug, so thank you for teaching me.
Yeah.
And what's funny to think of too is sebum is oil, right?
Yeah,
So if you're secreting inflammatory sebum from fried foods and canola oil and not healthy anti-inflammatory omegas, that's going to make more of a toxic junk for the microbes to feast on your face. So we really, really want to clean up the oil that we're putting in our body. We want to put the good stuff in.
yeah, and I think it's just like a little bit of education, so I'm glad we're talking about this so people know, like, sometimes we don't know, like, there's 10 oil options in the store, and then you're like, "Okay, I don't know what they all mean,"
Right.
and we just go with, like, the cheapest one, right? But
Uh,
now it's, like, knowing that, maybe stick to, like, the olive oils, avocado oil, coconut oil, they're
that's
good at
exactly correct.
fat as well, they're not as
Mhm.
processed as, like, canola oil, corn oil.
Yeah, I mean, even butter, even though it's not an omega and anti-inflammatory, it's still your body knows what to do with it because it's a real fat.
Yeah,
Uh, Canola oil, no. The seed oil, it's just like it's bad. It's inflammatory and it's in everything.
yeah,
Every time you go to a restaurant, you're getting it.
yeah,
It's just
it's cheap and
uh-huh.
man-made and yeah.
Exactly. Cheap and readily available. Yeah. That's America.
Yup. So what are some of your tips for, like, say you get these results, you take these supplements, how can we maintain the results? Because like we talked about, there's no cure for PCOS,
Yeah.
it's lifelong. So how can we maintain it? Like, do we have to be taking these supplements like forever, or what's your tips on that from your team?
Yeah, you do. My experience has been we can, definitely in the beginning, lots of cleansing. Then you can back that off and just do it, once a quarter or twice a year. You can potentially lower the dose. Like I started on N-acetylcysteine. That's the one I forgot. That's the other supplement I forgot. So when I started, I was taking 9 500 milligram capsules a day of N-acetylcysteine.
Mm,
Now I'm down to like, I just take 3 a day. So in the beginning, and not everybody, but if you
yeah,
need a higher dose, and then you lower it to a maintenance dose. You have to take it. I have seen women that stop taking it and the acne comes back, the periods get messed up again. It's just, we have to manage it forever, unfortunately. But everybody already is taking supplements anyway, for the most part. So it's like, at least you're taking 5 that you need that are
yeah,
for your body instead of like, oh, I read this is good for this on Google and I want to take this and
yeah.
this. Like it's actually customized for you.
Yeah, definitely. And I think also, like, it has to be addressed both ways, like, you can take the supplements, but you also have to do the lifestyle changes, like, you
Yeah.
can't out supplement a bad lifestyle or bad diet,
Yes.
right? Like,
Yes.
you can't be eating those oils and then expecting your cells to respond to the supplements, right? So, like, you have to
Yeah.
make sure you're cleaning that out, you're
Hmm.
eating the fruits and vegetables, not just eating processed food and
Exactly.
managing
Yeah.
everything. And yeah, I like how you said that, maybe you might need to start on the higher doses, but then over time you can lower it
Yeah.
if you're seeing results. So
Yeah, exactly. And sometimes like I won't take everything. Like I ran out of my NAC Pro and like I haven't taken it for a couple months and I still feel okay, but I'll bring it back in. I just have to remember. But it gets in the beginning, you have to be really diligent and then you can kind of back off. But I still have everything in rotation constantly.
Yeah, and that's my other question. So like when you supplements are started, like how do you know what's working and what's not working? So like is the recommendation like maybe try one for a couple months or do one like
Great question.
protocol for a couple months, or yeah, how do you approach it?
So
So you know which ones are working and then which ones to like take away.
sure. So first, it depends on how much data we have from your labs, right? Like
Right. Okay.
some people don't want to pay for all that stuff, but once I know that they have PCOS, I just put them on the whole kit, because even myo-inositol, if you don't have insulin resistance, it still helps with testosterone profiles and ovarian health.
Yeah.
So it's still a good one to put on. But if you want to be really diligent, you could just try one supplement at a time for 90 days and then add
Yeah, I
another
was gonna
for
say it's
90
gonna be a
days.
journey because you need to
Journey.
be on it for at least 3 months to see like
Yes.
numbers.
Or the other way that would probably be smarter to do, now that I thought of it, is try all of the things for 90 days, then start pulling one out and see if you still, if you feel really good at 90 days, or just however long it takes to get you feeling good. Let's say it's 6 months, then say, okay, I'm going to take out the myo-inositol. And if you felt different, okay, we know we need that. Try taking out the andro assist, and maybe you feel okay without the andro assist or whatever is driving down the androgens, fill in the blank. Maybe you feel okay without the N-acetylcysteine. Yeah. So you could try it like that as well. And then just start with the base dose. And then you can, if you're not feeling enough, instead of adding more products, add higher dose of each thing.
I think it's also important to mention, like, I know it may seem like 3 months or 6 months is a lot, but I think it's important to mention that, like, if you've had PCOS, you probably had PCOS for longer than you think you did.
Probably your whole life, yeah.
Yeah, you've been misdiagnosed for years probably, so by the time you get to the point where you're, like, ready to take care of it, you've had it for years and years, so it's gonna take time to address it, for your body to change. So 3 to 6 months may seem like a long time, but in the grand scheme of things of having PCOS for years and years is actually not that long.
And they're going to tell you the same thing. If you get on birth control for your face or spironolactone or Accutane, they're going to say 90 days to 6 months. That's what cause a physiological change in your body that you can actually feel. It takes time. That doesn't mean you won't feel a little bit better on month 1.
Yeah, exactly.
To really get that full result, 3 to 6 months.
Yeah, I think we're now in a society where we want instant everything. Like, okay, if I take this pill or this
tomorrow,
I make this one. Yeah, tomorrow I want the results, right? But if we want the changes to last, they're also going to take time. So I think that, just want to clarify that for everyone.
Yeah.
And before we wrap up, I wanted to know if anyone from the community had any questions. You can come on or you can drop it in the chat. There's like someone on right now, so we'll see if they pop a question in.
Okay.
And in the meantime, what is the best way for everyone to connect with you? And if they want to see, okay, great. She said no questions, but very informative. Thank you.
The system is so cool how it just pops out like that.
Yeah. Where can the viewers and listeners find you and your products and your services?
Sure. So if you would like to work with me as a practitioner, it is DMD for Diana Marie Drake, naturalmedicine.com. And I actually offer a 15-minute free phone consultation that you can sign up for. That way I can hear about what you're going through and just so we make sure it's a match for your case. And I do specialize in a lot more than PCOS, so you can come to me for most things. If you just want to buy the PCO Assist kit or test yourself for PCOS, you can visit skinnaturopathics.com. That's SKINNaturopathics.com.
Perfect. And I'll put that information in the notes as well.
Okay, cool.
And are you on Instagram? Or?
Oh, yes, I'm on the gram. I'm on the TikTok.
Okay,
I'm
perfect.
all over.
What's your
under? Okay, so on Instagram, it's DMD Natural Medicine or Skin Naturopathics. So I have both. And on TikTok, it's just Diana M. Drake. I also have a bunch of YouTube videos out under DMD Natural Medicine. I talk about why our hormones go down. I talk about different protocols. I talk about EMFs. I talk about water, all kinds of fun stuff.
Oh, great. Amazing. Yeah, this was a really great, informative conversation. Thank you for taking the time out to educate all of us today.
Thank you, Doc. Thank you.
And just want to wrap up by saying to everyone, as always, be kind to yourself, be patient, and focus on progress, not perfection. And we'll catch you in the next conversation. If you loved this conversation and want to participate in live conversations with guest experts, be sure to join the PCOS Holistic Healing community. If you're listening on the podcast, please leave a review. If you're watching on YouTube, be sure to leave a comment or any questions you have for the guests. Connect with me on social media. My handle is at pcos.holistic.coach. Send me a DM and say, hey, I'll catch you in the next one.